Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Hi there, Dr. Darrow.
Nita, are you living it up?
Always.
Me too. I'm always living it up. Just ask me anytime.
I feel great. And we want our listeners to feel great. How do you think we should proceed to make that happen?
Well, it's easy. We're here to get rid of musculoskeletal pain. That means orthopedic issues, neck, actually the back of the head sometimes, all the way down to the bottom of the feet and from the shoulders and elbows and wrists and fingers, arthritis, all kinds of stuff, all kinds of syndromes, meniscal tears in the knees, rotator cuff tears in the shoulders, toe arthritis. Boy, a lot of people have that. Plantar fasciitis, that's the bottom of the feet that hurt. Pretty much anywhere around the body that hurts, we inject PRP, platelet-rich plasma, or stem cells with that mixed up. And it's been working for years and years with thousands of patients. And I have to say it doesn't work on everybody for several reasons. Sometimes people don't do enough treatments, and they go, it didn't work. You told me it would work. I go, I never told you anything. I had you sign a form that says there's no guarantees in medicine of any kind at all. So it's one of those kind of things, you've got to do it. You've got to listen to the doctor. And it's not like going to a surgery where you think there is an end point, which there really isn't in surgery. Let me give out the phone number. I want to get somebody more interesting than me on the phone here.
Works for me.
We love our callers, and we would love you to call in right now. And the number to talk to me live and to hear Nita laugh live, because we're going to make her laugh. If you don't call, we're going to tell her give her some hard jokes to answer, and then put her on the spot.
Ah, the torture hour.
Yeah. So the number here is 866-870-5752. So write it down. If you're driving, pull over to the side of the road if you want to talk to us. It's always best to get off your Bluetooth so we get a clear line with you, too. So are you ready? 1, 2, 3. 866-870-5752. If for some reason you can't call me right now and talk to me live, you can call the office. There are people by the phones even now, and the number there is 800-300-9300. I'll repeat it for you again. That's 800-300-9300. And for those of you that want to see these injections being done, very simple. Just go to my website. We've got tons of videos on there. And the, what do you call that? The browser name?
The browser? You mean
browser.
where you...
Just stick this in the browser. www.
Yes, you're right.
.lastemcells.com. www.lastemcells.com. And also on that website, on every single page, there is a spot where you can email me, and I will get back to you. I get back to all my emailers from all over the world every day. And once again, that's www.lastemcells.com. I'd love to hear from you live right now at 866-870-5752. But there's a lot of ways to contact me. All of my patients get my cell phone number and my personal email address, too. When I tell my patients that, they go, how can you stand that? And I tell them, because my work is my life. And I've been doing this for, over 25 years now. And I've been teaching it. Actually, I taught it at UCLA, where I graduated from during my medical residency. Ever since then, for over 20 years, I taught there. So it's something that is getting out in the public, thank goodness. It's an alternative to having surgery. In most cases, there are cases where we do need to have surgery. Simple things like a broken bone that needs to be put back together, you often need surgery. But most musculoskeletal disorders, all these orthopedic things, in my humble opinion, should not be operated on. Why do I say that? Many reasons. The first one is because I had a shoulder surgery from my boss in medical school that went bad. He didn't do a bad job, it just went bad. And it took about 4 years before I discovered what we call regenerative medicine, injecting with platelets and stem cells, before I injected my own shoulder and healed it overnight. One treatment overnight, complete range of motion that was limited before, and pain-free. So that was a wake-up call. Also my right wrist from a golfing injury, the shoulder was from a weightlifting injury, and I had my arms spread pretty wide because I wanted to build up my lateral pectoralis muscles because I'm a little bit round-shouldered because of doing all the push-ups my whole life. So the pecs were big, and I didn't really work on my back much, so my shoulders slumped a little. So I thought I'd pump them up, and what I did is I tore my rotator cuff and my labrum, and I injected it one time, woke up the next morning completely healed. I did injure it again 12 years later in a different way. That was a golfing injury, just overuse, and that took 2 treatments. So this has been good for me. I've injured it one more time. That was, I can't remember when, and that took more treatments. So people always ask, it's like the first question, how many treatments will it be? Is this a magic cure? No, it's not a magic cure. It just makes sense. It makes sense to rejuvenate the body rather than to cut tissue out. When we cut tissue out, then we end up typically after we tweak the joint later with another surgery, and then the final coup d'etat, is that how they pronounce it? A coup d'etat is having a joint replacement, which I really do not like the idea of at all. And I get patients who come in every single day ready for a joint replacement. I just had one yesterday. He was ready for a reverse shoulder replacement. He didn't want to do it, and he actually wasn't really having pain in his shoulder, just limited range of motion. He had some arthritis, and most of his rotator cuff had been torn. He had been an MMA fighter and did a lot of sports real heavy. And he said, I really don't want surgery because the doctor says that there's no pain that'll be reduced. And even if there was, there may be pain afterwards when there wasn't before. So he had a very, I'll say an honest doctor, someone who's really telling him the truth that he could come out worse. And unfortunately, most doctors don't tell their patients that. I get them after a failed surgery, like I had myself, and then it's too late. It's difficult to undo putting a knife in your body. It's easy to get an injection. It's we call percutaneous. So percutaneous treatments are just getting injections, and that's what I do with the PRP, platelet-rich plasma. Simple procedure. We just draw your blood, spin it, and then inject it, or adding stem cells. We can do your bone marrow if you like, and that takes me about 15 seconds. I've done mega thousands of them over the years. So it's real easy to do, and there's a lot of controversy out in the public on the internet about what the best treatments are, and those what you read is typically by doctors who don't really know what they're doing, or by doctors that have what I'll call a dog in the fight. There's some people that make money selling bone marrow kits, and of course bone marrow is the only thing you can do then. So when people ask me questions about anything, politics, whatever, which I don't like to get into, but I always say just follow the money. It's all about money on this planet. I'm sorry to say that. In medicine, which is a higher art form, you would think, is still money-driven. And it's unfortunate. So I want to talk about a couple other things, Nita, if you don't mind. Or do you have somebody waiting
for me? I
for
wanted to say something. I
Yeah,
wanted
please.
to let people know you're too modest to mention that you wrote yet another book, and your latest book is called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And when people call the show today, they will get a free copy.
Yes, I'm showing it to the video camera right now, and it's got all these wonderful sports figures in it, like my 5 children, each of them doing different sports. But there's my son Benji on a 60-foot wave, my daughter Jensen, who's used to be a dancer, and who else have we got here? We have Jordan, who's the captain of her D1 soccer team. That's doing very well. And then where's Brittany? Brittany's a runner. And also many other athletes are in here. I've got some big wave surfers and other people that I've worked on here. And many different diagrams of, well, here's post-surgical. I'm looking at a guy's back who has pedicle screws. And the first time I saw this on an x-ray, it was during medical school when I wanted to do research on back surgery. And the surgeon that I was working with, Larry Gordon, showed me this. And I said, "You have to be kidding me. You put that in people's backs?" And he goes, "Yeah, we do it every day." And then I did a study on that and found that it had a high failure rate down the road. Same thing, we see with research on knee surgeries. It seems that the people that have the fake surgery do as well as the people that have the real surgery. 2 years later, after a surgery, the joint breaks down. So I'm not sure why doctors are still doing these surgeries. I really am not sure. I don't understand it. It's pretty crazy to me, and I have friends who are orthopedic surgeons, and we want to duke it out because they say what I do doesn't work, and what I say to them is what you do hurts people. And I say, "How do you know it doesn't work?" And they go, "Well, I tried it once on somebody, and it didn't work." And these treatments of doing PRP and stem cells are not going to be guaranteed to work right away. Sometimes it takes a few treatments to grow enough tissue, but at least we're doing something that is natural. It's a natural healing of the body. So why are we going to cut tissue out? I don't get it. Now this book has 264 reviewed studies on why regenerative medicine works and how it works, and a lot of studies on why surgery fails. So I'll say it like this. The white horse that I've ridden ever since my medical training at UCLA was to do regenerative medicine, something I fell into very early in my career because I had pain. And I had another doctor inject my wrist first, and then I injected it myself a couple more times and healed it up. And then my shoulder. Then I did both of my knees over the years. I've done both of my elbows over the years. And the first one that I did on my shoulder is my right shoulder, which had been frozen at one time. You know what a frozen shoulder is. You can't lift it. And then my left shoulder was injured. I had a skiing accident when I did my internship in Denver, where I did my internship so I could ski.
That was clever. That's my hometown, you know.
Oh, I didn't know that.
Yes. I was born there.
All right. And how old were you when you were born? See, I know how to. You were born at 1 hour old. That's very advanced. So there's also something I'm showing a photo in the book on page 117. And by the way, we're going to mail you, free of postage and everything else, a copy of my book, which is Stem Cell and Platelet Therapy, Regenerate, Don't Operate. If you want to call in right now, we will mail it out to you. And I think it's an amazing book.
And the number is?
The number to the studio right now, live. Please call. Take Nita off the hot seat. 866-870-5752. I'll repeat it for you if you're driving. 866-870-5752. And you can also call the office at 800-300-9300. So this particular photograph on page 117 is injections on the face of PRP. It's called the Vampire Facelift. And some very smart doctor trademarked that name. It's very catchy, meaning vampire, meaning it's blood. It's the platelets. And it's injected into the face. The face is numbed up. And very simple process. And what it does, it stimulates the collagen in the face to grow. When we inject it in the tendons and ligaments, they regrow. We have muscle tears that we grow. And we can also mix that with stem cells for the face. And then on page 129 are photographs of someone's head before and after treatment. He's a 29-year-old male. You can see on the left side here, or actually it's which side to you? The right side as you're looking at this, the hair thinning and then it thickening up. So these treatments actually can thicken up the hair also. It's not going to work actually it'll work, but it's not going to do enough good to inject a totally bald head. But if somebody is thinning, then I will check their hormones, because hormones have a lot to do with hair growth, and we will balance the hormones and see if that helps the hair grow also with it. We've got a few callers here, so if you don't mind, Nita, I'm going to go to David in Yorba Linda. He has a shoulder issue. So, David, God bless you for calling in. Thank you. And how old are you, David? David, I can't hear you.
Oh, I'm sorry.
There you go.
Can you hear me now?
Yeah.
Okay. It was
Now I can't. Keep your mouth over
great.
There you go.
So I'm really calling for my wife.
Okay.
She has a shoulder issue. It was kind of a slap tear. It might have just been one of her tendons, but it was not there for a while. On her other shoulder, she actually got PRP, which helped very well, and it took a long time actually to fix it. And just wanted to find out what's the best way to get involved with you. You guys are kind of far from us, so it's a long distance. Are there any other really good practitioners down in Orange County, Southern Orange County? There
may be. I don't know who they are. I've been told that I do the most of anybody on the planet. I don't know if that's true or not. So I would say this. Anytime you're picking any doctor, I don't care what type of doctor. It could be a kidney doctor. It could be a plastic surgeon. Whatever it is, you got to do your homework. And and once you finally find the person you like, then you actually have to have a conversation. And the questions will be things like, how many of these particular procedures do you do every day of the week?
Yeah.
Most practitioners that do regenerative medicine don't do a whole lot of it. And when I'm at national meetings, people come up to me and they say, you do more in one day than I do in a month. So any medicine, I don't care what it is, you want to go to the person that does the most of it.
Agreed.
So that's the first answer to your question. And then there's another answer or question that's lingering inside of you that I'm picking up is, what's the best way to do it? And the way I do it is frequently. The reason for that is there are many practitioners that will do this, let's say, once every 3 months. Well, how long are you miserable for then? Months and months and months. And in the meantime, patients get frustrated. So they're going to do activities that are going to backtrack them. Now, every time you get a PRP or stem cell injection, there is tissue that grows. There's studies that show that. It's called granulation tissue. It's the healing tissue that starts growing. So we know it's true. We know it works. I can actually see on x-rays, let's say in a knee, more cartilage growth down the road. Okay? So a lot of people come in, there's no space between the joints, and after we do treatments, when we look down the road, and it takes months for the tissue to actually remodel and show increase in growth. But in the meantime, people usually feel better a lot sooner. So I don't know if you were listening to the beginning of the show. The first time I did my right shoulder, it was healed overnight. It was like, that time I thought, boy, that's magic. And my wrist was the same thing. My wrist only healed 50%, But that was magic because it hurt so bad that it went to very minimal pain. But I've had parts of my body that I've had to inject many times. So as an example, I've probably told this story many times. I was overusing my body, as I always do. I was running too much, and I was hitting too many golf balls. So my right knee was starting to hurt, and of course I don't pay attention to pain until I'm immobilized. It's true. That's just the way I am. I push it, and then eventually I can't do anything, and then I inject it. So I was playing golf during the pandemic, and we weren't able to ride in a cart, and I played at a place called Mountain Gate, which is extremely hilly. So I was using a push cart, and we have kikuyu grass there, which is very thick, and it was hard to even push the cart up and down the hills, if you want to call them hills, some are mountains. And I blew my right knee out, and I limped off the course, drove down to my office. It was a Sunday afternoon, and I looked inside with an ultrasound and freaked out because I saw a huge amount of what we call an effusion. There was fluid in my joint. I don't know if it was blood or just synovial fluid. So I aspirated it. It was luckily not blood, meaning I didn't really tear anything. It was just synovial, nice, clear yellow fluid. And then I injected myself 4 times in that 1 week, okay, and healed up my knee. All right? So people say, you mean you do it that much? And I say, well, not for you, because most people don't want to do it that much. But I think the fastest healing is going to be doing it repeatedly, as close together as you can. Get the most cells in there that you can. And every time we do an injection, there is an inflammatory cycle that takes place. And people always ask, well, why do you want to inflame the area? It's already inflamed. Yes, it is, but not enough inflammation to create a healing. The body's natural healing in musculoskeletal pain, orthopedics, is through inflammation. So in my first book on the subject matter called Prolotherapy, Living Pain-Free, which I did many, many years ago, and prolotherapy were the injections with sugar water or with sodium moruate or zinc sulfate. They basically just created inflammation. And then from the inflammation, fibroblasts, which are cells that grow collagen, are sequestered to the area where the problem is. Okay? So that's old school. Now when we use platelets, PRP, or stem cells mixed in, we get not only a bigger inflammation, but we have growth factors and cells that actually grow tissue. So they're much more superior types of healings that take place. So I still have a rotator cuff tear in my supraspinatus. That's the most common tendinitis that we get, or tendinosis, and tear. And in my subscapularis, how do I know? I looked with an ultrasound. And a labral tear, slap lesion like your wife has. But do I have any pain? Nope. So don't get confused with the pathology that you see on an image and pain and mobility. They're not necessarily related. I know that's news to everybody listening, because unless my own patients are listening, because they know. And in my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate, which I'm going to send out for free if you call in now to the studio at 866-870-5752. There are studies that show that when we take people who have zero pain, we're going to find rotator cuff tears, meniscal tears, herniated discs, all of these, quote, terrible things that doctors find on MRIs. They don't necessarily cause any pain. Is that your wife in the background, David?
Yeah, it is. Yeah, and she didn't know I was calling. But
okay.
Does insurance ever cover this, doctor?
Yes, insurance can cover things like accidents. What else? Sometimes workers' comp will do it, but general health insurance does not.
Not usually.
Not ever. General health insurance, no. If you want to hang with us, you may. We're going to the break, and it'll be a short break. I'd love you to call in at 866-870-5752, or call me at the office sometime, 800-300-9300, or go to the website, watch videos of the procedures, www.lastemcells.com. Thank you for listening, and we'll be right back.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.